Whether you've been working on it for 2 years or whether you're just starting to get yourself together and your program together, I think there really is one big question that we should ask ourselves. And that is, how can we touch every single patient? So I like to use the examples of bubbles to represent patients that are just floating around in our system. Some have a direct path, some wander around aimlessly, and some just get lost in the halls. I have some fun examples that I'm going to use later, and one is some handy bubble guns. So come on up here, Margaret. So Margaret, who works with me, I'm going to pretend that she's a nurse navigator, and she's a really, really good one. She's got octopus arms. She can follow anywhere from 250 to 300 patients a year. So the bubbles I'm about to blow with my fancy bubble guns, those are going to be the patients. Just as I told you guys before, I like to use the bubble example for patients and how they float around the system, and some get lost, some wander around. But Margaret here, she's going to try to capture all these patients and touch all these patients. All right, you ready, Margaret? Ready. Boom. All right. Okay, so she's doing a pretty good job, right? Good. There's a whole lot of them. She's got three, maybe. All right. That's a good idea, right? So this is just one person. Thank you. Thanks, Margaret. You don't always get your boss to jump around and pop bubbles.
That will probably be the only time.
Thank you. So, what if you had a system that takes on 500 new patients a year? How many navigators and survivorship navigators do you think you would need to budget for? So whatever that number is, remember that you're going to have to double that number next year. Because next year not only have 500 from this year, but you're going to have a new 500 coming in the next year. So that means Margaret trying to pop all and touch all of these patients, pop all of these bubbles. She's going to have 2 more people on the other side for next year, even creating a bigger scheme. So now what about a system that takes on 6,000 new patients a year? If this were my system and Margaret were my navigator with her octopus arms, I'd need about 20 navigators. That means I'd be expending anywhere between $1.6 and $2 million a year just in FTEs alone. What's needed, and I think everybody knows this in this room, is a more efficient way to track and navigate patients through the system, where navigators can not only follow more patients, but be able to report back on everything they've experienced with each patient's process.